Hello, my name is Adolfo, and I will be doing my presentation on NEXLETOL, also known as bempedoic acid. NEXLETOL is a prescription medicine used along with diet and other lipid-lowering medicines in the treatment of adults who need additional lowering of quote-unquote bad cholesterol, so known as LDL, and also they have to have a heterozygous familial hypercholesterolemia, sometimes abbreviated as HEFH. It's an inherited condition that causes high levels of LDL and or also known cardiovascular disease. It works by reducing the amount of cholesterol made by the liver. Lowering the bad cholesterol may help decrease the risk of heart disease and help prevent strokes and heart attacks. For some background, NEXLETOL is the first oral once-daily non-statin is the keyword LDL lowering medicine approved in the U.S. in nearly 20 years for patients with ASCVD or HEFH. The FDA approved NEXLETOL to lower LDL in 2020. Mechanism of action of this medication is that it is a prodrug, so it does require activation in the liver. The very long chain, the acetyl-CoA synthase ACSVL1 enzyme is responsible for the activation, and then that changes it into its active metabolite. ATP lyase, also known as ATP synthase, plays an important part in the cholesterol synthesis. There's the BETC1002-CoA, which directly inhibits this enzyme after the parent drug is activated in the liver by coenzyme A, CoA. This inhibition leads to the upregulation of the LDL cholesterol receptor, reducing serum LDL via increased uptake and LDL clearance in the liver. For some of its pharmacokinetics, its absorption is rapidly absorbed in the small intestine. It has a Tmax of 180 milligrams per tablet, estimated at 3.5 hours. Its volume of distribution is about 18 liters. Metabolism, the two main metabolites of bempedoic is the ETC 1002-CoA and ESP 15228. Bempedoic acids conjugates are primarily eliminated via the urine. It's about 70% of it gets excreted in the urine and 30% in the feces. A total of 5% of the unchanged drug is excreted in urine and feces combined. Some indications for this drug is that bempedoic acid is indicated as an adjunct to diet and maximally tolerated statin therapy for adults with a heterozygous familial hypercholesteremia or existing atherosclerotic cardiovascular disease. The combination of bempedoic and ezetimibe is also indicated with diet management and maximally tolerated statin therapy to treat elevated LDL levels. In monitoring patients for signs and symptoms and treat with urate lowering drugs when deemed appropriate. Interactions were to avoid concomitant use of NEXLETOL with simvastatin greater than 20 mg. So usually don't want to have a stronger dose than simvastatin 20 milligrams, and you want to avoid also same use with pravastatin greater than 40 milligrams. Cyclosporin is a common medication that has a very potential interaction with it. It should be exercised with caution when using NEXLETOL, and then also cyclosporin, it causes an increased exposure to both the ezetimibe and the cyclosporin. For fibrates, the co-administration of NEXLETOL with fibrates other than fenofibrate is not recommended. Fenofibrate and ezetimibe may increase the cholesterol excretion into the bile, leading to cholestasis. Cholestyramine, same use with NEXLETOL, and cholestyramine decreases the ezetimibe concentration. For dosing, the dosing of bempedoic acid is 180 milligrams once a day, with or without food. No dose adjustment is needed to be done with patients with mild or moderate kidney function impairment. That is defined as having an estimated EGFR greater than 30. No dose adjustment needed to be done for patients with mild to moderate hepatic function impairment as well. Some fair warnings about this medication is you do have a increased risk for hyperuricemia. So this is elevations in the serum of uric acid have been reported. You want to assess uric acid levels periodically as clinically indicated. Tendon rupture, bempedoic acid is associated with an increased risk of tendon rupture or injury. And you want to avoid NEXLETOL in patients who have a history of tendon disorders or tendon ruptures. Some precautions: the product may contain inactive agents which can cause allergic reactions or other problems. You want to talk to your pharmacist or doctor for any other details. Before using this medication, you want to tell your doctor or pharmacist about your medical history, specifically if you have liver, kidney, or tendon problems. Before having surgery, tell the doctor about all the products you're using. This includes prescription drugs, non-prescription drugs, any herbal products, or any blood thinners that might be present. Older adults may be more sensitive to the side effects of the drugs, specifically that tendon rupture. Tell your doctor if you become pregnant or plan to become pregnant. You should not become pregnant while using bempedoic acid. And then bempedoic acid may cause harm in unborn babies. So if you become pregnant, talk to your doctor right away about the risks and benefits of this medication. So I'll probably switch it over to a more baby-friendly medication. Some adverse reactions of this medication are the symptoms of the common cold or flu. It also causes some muscle spasms, back pain, pain in the legs or arms, stomach pain. And that concludes my presentation. Thank you so much. These are my references.